Hello, my name is Sabrina Fabi and I'm a board-certified dermatologist practicing in San Diego. And today we have a beautiful 32-year-old patient who's coming in because she's been noticing that some of the lines in her glabella are forming because she frowns a lot. And so if you can frown for us, Michelle, people can see that she's got these very strong corrugators, or the muscles that we call them, generally responsible for what people call the 11s or the 1, depending on how many wrinkles end up forming. She also notes that her forehead is pretty expressive when she looks at her child in a surprise fashion, her new year-old baby. And also she notices that when she smiles, these wrinkles are forming. Now we obviously want to keep her natural expression and we want her to be able to continue to smile because she looks lovely when she does, but she doesn't necessarily need the lines and wrinkles that accompany that smile. But in addition, what I see in her and what we've been seeing more and more prominently is that people clench at night, and when they clench, they're using their masseter muscle, which is the largest muscle in the entire face. And so with that, it ends up highlighting the lower third of the face, causing a more angular appearance, causing a more squared look, and taking the focus away from her beautiful cheekbone or her mid-face. And so with a little bit of Xeomin today, which is the neuromodulator we're going to be using, the most new neuromodulator that was introduced into the market about a year and a half ago, we're going to be able to soften that, soften the lines that are forming in her glabella, raise her brow just a little bit by pulling a little bit of Xeomin in the tail of her brow and giving her a more refreshed, natural appearance. So if you look at this patient straight on, you can see that when she clenches her teeth, there's essentially a bulge right here along her mandible. And that's really her masseter muscle that has been activated and used all throughout the night while she clenches. And what I see in a lot of patients that come in, they start getting tension along the sides of their face, sometimes even an inflammation of their temporal mandibular joint because of activation of that muscle and it being overworked. And by relaxing it with a little neuromodulator, whether it's Botox, Dysport, or Xeomin, which is what we're using today, one can relieve that tension and also reshape the face by taking the angle and the focus away from the lower part of the face and putting it right back up into the mid face where you can see she has beautiful cheekbones and volume that we want to highlight. So that concludes the treatment. It took a total of 2 minutes to do. You can see our patient looks fine, normal. She can resume her daily activity. Generally, we just ask our patients to not do downward dog or strenuous jumping or activity for the next 4 hours. But otherwise, they can really just put on makeup and carry on with their daily life. And so if you ask our patient how it was
great. It was painless and happy I can just go about my day.
Yeah, so, and then what we'll see is that she can come back at 2 weeks because that's usually when Botox, Dysport, or Xeomin take their maximal effect, and we can reevaluate to see if she needs more or make notes if she's not happy or wants less at a follow-up treatment. But generally we start with less in the beginning so that we can aim conservatively and add if we need to. And then really the results will last 3 to 4 months. If patients continue with their treatment regularly, what we notice is that results really start even going on for as long as 5 to 6 months so that patients don't really require so many treatments every year.